Meeting patients' cultural and linguistic needs is an essential part of providing culturally responsive care. Imagine a scenario where a patient's care and well-being are negatively affected because they or their family cannot communicate well with their healthcare providers due to a language barrier. In a case unrelated to AHC, a 9-year-old Vietnamese girl whose parents spoke little English suffered from a reaction to the drug Reglan. The patient had a severe infection and suffered a heart attack. Her parents spoke Vietnamese, yet no qualified interpreter was used to explain her condition. Records show that the 9-year-old patient and her 16-year-old brother served as interpreters during the medical emergency. When patients don't have access to interpreter services, they may receive poor quality care. Also, the physicians and other care providers involved in the case may face legal and financial risks. As a team member at Adventist HealthCare, you should understand federal regulations and corporate policies on meeting patients' communication needs. You should also be able to explain how to find and use interpreter services at your facility. Over the years, federal policies and healthcare regulations have evolved to help providers communicate better with patients. Hospitals and healthcare providers must provide qualified interpreters at no cost to patients. According to our interpreter services policy, team members are responsible for identifying patients' communication needs and language preferences and using qualified interpreters. If qualified interpreters are used, providers must document this in the patient's chart. Signs showing available interpreter services should be posted in our facilities. It's important to note that minors and family members should not be used as interpreters. Adventist HealthCare uses interpreters and trained qualified bilingual staff to provide interpreter services at no cost to patients. We provide over-the-phone interpreters who speak more than 200 languages and video interpreters who speak more than 30 languages remotely. Our hospitals provide on-site medical interpreters for spoken languages or American Sign Language. On-site interpreters can be scheduled by nursing administration or your local language access coordinators. To translate written information like consent forms, document translation vendors are available. In addition, we are proud to offer the Qualified Bilingual Staff Program, or QBS. QBS are trained and tested to provide interpreter services at 2 levels. Level 1 is customer service, giving directions and simple instructions to patients and families. Level 2 is medical interpreting in clinical settings, where an understanding of medical terms and concepts is required. QBS can communicate with patients directly in their preferred language and can interpret for other team members. QBS cannot translate written documents. For patients who are deaf or hard of hearing, we provide on-site language interpreters or video remote interpreters using interpreter services apps on tablets. Contact nursing administration or your local language access coordinators to request an interpreter or a tablet. You may also dial 711 to use Maryland Relay, an improved form of TTY text telephone, and a free public service you can use with any standard phone. If a patient refuses to use an interpreter provided by the hospital, explain that it is our responsibility to provide a qualified interpreter at no cost to them. If they still refuse, then dial an over-the-phone interpreter and put them on speakerphone so that the qualified interpreter can actively listen, correct any errors, or assist if needed. Remember to document all interpreter services provided in the patient's medical record. In the case of the 9-year-old Vietnamese patient, can you identify the mistakes that were made in her care? How would you improve care for the patient? 1. Use a qualified interpreter. 2. Avoid using minors as interpreters. 3. Use translated consent forms. AHC serves diverse patient populations that speak different languages and have various communication needs. It's up to you to identify those needs and language preferences and provide solutions at no cost to the patients. Remember, responding to patients' social, cultural, and linguistic needs is how we provide a world-class patient experience to every person, every time. To make this the best place to receive safe, high-quality care, always use qualified interpreters, in person, phone, or video, and document it.